We'd like to welcome you to BeMoreNews.com, the news before the news, where we uncover the truth. We're here with Brian Smedley of the Joint Center for Political and Economic Studies, and we're in Park Heights in Baltimore. What's the purpose of today's visit, Brian?
Today's visit is to learn about why place matters for health, why where you live, where you work, where you play is important in helping set the context for your health. As we like to say, your zip code is more important than your genetic code to determine health, but we're about finding solutions. And so importantly, we got to understand what the needs are in the community, what power structures exist within the community, what are the resources that communities have to help improve conditions for health. But we've got to take this not only from the local level all the way up to national levels to help people understand. And really, ultimately, it's about justice, it's about opportunity. So when we do that, we ensure that people have good health.
Okay, now, is this a part of a national or federal initiative?
It's a national initiative of the Joint Center called Place Matters. Through our Health Policy Institute, we are working in 24 different communities like Baltimore, trying to help understand what are the social and economic conditions that shape health. Importantly, because of residential segregation, as we're seeing here in Baltimore, in many cases, communities of color suffer from higher health risks because of things like environmental degradation, an abundance of poor sources of food,
brain drain,
all of those kinds of things that really disempower communities and lead to disinvestment. And so what we're trying to do is help communities to give voice to their concerns and to find ways to shape positive solutions.
Okay, now you're comparing this community, Park Heights, historic northwest Baltimore, predominantly African-American community, but you're also visiting Roland Park, which is upwardly mobile, majority white community, and also in North Baltimore. What is the goal of such a comparison?
Well, we want to show people the stark contrast between a community like Roland Park, which has an abundance of good resources, good schools, stores where you can buy nutritious food, jobs, all the things that lend opportunity. That's a high opportunity community, in contrast to also visiting some communities that don't have those same opportunities.
Good deal.
So, no matter how hard you work, we can't overcome some of those barriers without power.
Park Heights Community
Thank you for your
Health
time.
Alliance, and this is the AFIA building, the Harry and Jeanette Weinberg AFIA Center. AFIA means health in Swahili. Right, and we've been here, the building has been here for about a year. It took us 10 years to get it built. It's been a community effort. We've had partnerships all through the Park Heights area. My name is Karen Evans, and the executive director is going to wheel his way. He may come through the back way. My name is Karen Evans. I'm the president. I've got a lot of hats on today. I'm the president of the board of the Park Heights Community Health Alliance. I'm also on the board of Associated Black Charities and have been involved with Place Matters, and it all ties in together. So we're happy to welcome you here. Like I said, I'm going to start a little bit and let Vic expound on what we've been doing up here. But the way this whole thing got started was through efforts with a coalition that started in Sinai's conference room talking about uncompensated care in the emergency room. And so we did a lot of homework, a lot of focus groups, and the bottom line was that we found out that men in this community were not getting primary care. And so our mission, our total mission is to provide health care just to make this a healthier community, not necessarily primary health, but just making this a healthier community. But our major goal was to build a clinic that would offer services